Hello, my name is Angel Jones, and today I'm going to do a disease presentation on an infectious disease, asthma. Now, asthma is a chronic inflammatory disorder of the airways. The features of asthma has implications for this diagnosis, management, and potential prevention of the disease. The immunohistopathological features of asthma include inflammatory cell infiltration. The cells that asthma can infiltrate are the neutrophils. The neutrophils are infiltrated especially in sudden onset or fatal asthma. This can also be an occupational asthma and patients who smoke. The eosinophils, the lymphocytes, and mast cell activation is also disturbed. Epithelial cell injury can also happen in asthma. Now, asthma and other viral respiratory infections are one of the most important causes of asthma and may also contribute to the development of asthma. Here is some of the pathology of asthma. Now, this here on the right side is the normal airway. The normal airway, as you can see, this is the smooth, relaxed muscle tissues. Around the airway, inside the airway, this is where your air transmits in and out of this tube. Now, this is an asthmatic airway. As you can see in the asthmatic airway, the tube is constricted. The airway, or your bronchial, is constricted. The wall is inflamed and also thickened. Now, in an asthmatic airway during an attack, you can see that the airway is pretty much closed. It has tightened, the smooth muscles around have tightened, and there is air trapped in the alveoli. So this doesn't look comfortable for somebody with asthma. There are signs and symptoms of asthma include coughing, especially at night, wheezing, shortness of breath, chest pains and tightness, feeling of pressure on the chest, like feeling of somebody putting a load of bricks on your chest. You can start losing your breath and having shortness of breath, feeling tired and weak and having mood swings. Some people with asthma can be really angry and grouchy. Decrease in lung function, and you can also check that by using a peak flow meter. This here is a peak flow meter, and I will talk about that later on in this video. Signs of a cold or allergies. These are symptoms of asthma. Some people mistake a cold and allergies for asthma. The other thing that is also mistaken a lot for is bronchitis. Bronchitis is often diagnosed when it is actually asthma. And people with asthma also have trouble sleeping. Now, in an asthma attack, things get worse. The wheezing is now severe. The coughing is uncontrollable. The breathing is very rapid. Their neck will tighten, and so will your chest muscles. You can have difficulty talking, anxiety or panic attacks. Your face can turn pale, and face will also start sweating, even maybe sweating of your hands. Your hands and your fingernails can turn blue, and so will your lips from the lack of oxygen. So make sure if you're having an asthma attack to get treatment or treat yourself immediately. Now I'm going to go over some key facts of asthma. Asthma is one of the major non-communicable disease. It is a chronic disease of the air passages of the lungs, which inflames and narrows them. Now, there are over 235 million people around the world currently suffering from asthma. It is a common disease among children. Most asthma-related deaths occur in low and lower income countries, even lower middle income countries. The strongest risk factor for developing asthma are inhaled substances and particles that may provoke allergic reactions or irritate the airways. Medication can control asthma. Avoiding asthma triggers can also reduce the severity of asthma. Appropriate management of asthma can enable people to enjoy a good and quality life. Now, the World Health Organization estimates that over 235 million people around the world have asthma, and I earlier said children, but this also includes adults and people of all ages. Asthma is underdiagnosed and undertreated. It creates substantial burden to individuals and families and often restricts individuals' activities for a lifetime. Now, the cause. The fundamental causes of asthma are not completely understood. The strongest risk factors for developing asthma are a combination of genetic predisposition and environmental exposure to inhaled substances and particles. These things may provoke allergic reactions, like I said. Some of those indoor allergens are house dust mites in bedding, carpet, and stuffed furniture, pollution and pet dander, outdoor allergies such as pollens and molds, tobacco smoke, chemical inhalants in the workplace, air pollution. There's also cockroach allergies that can cause asthma for people who live with cockroaches in their homes. Such things like mice can also trigger and promote asthma. Now, when you have asthma, you want to make sure to get, you go to the doctor. Well, even before you know you have asthma, you have to first get a diagnosis. A diagnosis of asthma can be hard. Now, doctors ask series of questions. They ask about symptoms over time. They kind of watch you and have you come in at different times. And most people are diagnosed when they have already come in with an asthma attack. They will also check for a family history of asthma because of the genetic disposition. They do a lung function test, and like I said, I'll show you that with the peak flow meter. They can also do x-rays of your lungs and see if there is a problem, like bronchitis or different things, or they can see how restricted your airway is. Now, with asthma, there are a couple of different things that you can do with asthma, and I'll show you some of those now. One thing that is very important that I think to me is making sure you treat asthma. Untreated asthma can kill you. Asthma is one of those things that I have seen people die from. I've known friends who have lost children to asthma, and personally I have a daughter that has asthma, and she has been dealing with asthma since she was born. It's been many trips to the hospital, many trips to the doctor, and this is not a fun disease to deal with. So one of the things that helps with asthma, and this is part of the treatment for asthma, is an inhaler. An inhaler is something that you can use at home when you are having asthma symptoms, or immediately if you go into an asthma attack. An inhaler is something you would take this inhaler upon an asthma attack or when one is starting. Then you take this inhaler and you would take a puff and inhale this. You'd wait about a minute and you'd take another puff. If that doesn't work, then maybe it's time to use a different effort or something stronger than that. Now, what I would go to next is actually let's see, what would I have here? I would go to a nebulizer. Now, you have a nebulizer here, and a nebulizer is where you will take medications, this is a liquid medication used for asthma. It is albuterol sulfate. You take this medication, which comes with these packets inside of that box, and inside of that package are these tubules. In these tubules, you will take one off of here, and you would put this liquid inside of this canister here, this container, and you pour that in there. You would close that, and you turn on this machine and inhale the medication until all of the medication has been used. That's one part of the treatment for asthma. So now I'm going to move this out of the way, and I'm going to show you that there are other ways. This right here is prednisone. Prednisone is a steroid used for asthma. There are different steroids that are used for asthma, but this is one of the main ones that is used. This is when you go to the hospital and your asthma is too severe, or you have had an asthma attack and you cannot control the wheezing. You can still not breathe. you would go to the doctor or hospital and they would give you steroids. On top of the steroids, they would continue those nebulizer treatments. Now, like I was telling you earlier about a peak flow meter, and I have two of them here today. So this is a peak flow meter, and this meter is a little different than the one that I will actually be showing you. This one here, you would open it up. Let's see if I can get it open. It doesn't want to move for me today. Well, there you go. Okay, you would open this one up and you'd actually open it and take it out of here. And when you take it out of here, it has a measurement on here to show the measurement of how deep and hard you can breathe out. You would take this and breathe out. It would then show you how high the measurement is for your breathing. Now that one is a little older model, but the newer model I have here, and it comes with different mouthpieces, is this one here. You would take this one here, and this one, as you can see, it also has those measurements, but you would breathe into this and it will tell you how far you can breathe. So this went up to about 225. You probably couldn't see that, but it is measuring my breathing, which right now I really didn't breathe that hard, so it's kind of telling me that my breathing is a little shallow. So this is something that the doctors will use and that you can have at home to check when you have asthma. You want to make sure to monitor your breathing and lung function with this when you have asthma, because this will help you to know how severe your asthma is and if you need to be taking further actions like going to a doctor. With that peak flow meter, you have a flow meter chart which you can chart down a daily record of what your breathing and lung function is. This is something you would want to take to the doctor when you are seen, and I'll tell you why. With every asthma patients, you want to have an action plan. Everybody that has asthma should have this plan, and you should keep a copy of this action plan with you at all times. Maybe in your wallet, maybe keep one at your workplace or school or wherever you go, so that other people know what to do in case of an asthma attack. So the action plan here, it tells you whether breathing is easy. You would want to document the no coughing, no wheezing, no shortness of breath. Can you work? Can you play? It asks you about your peak flow and the medicines that you have tried to use. It tells you to go. The things you can do to maintain your therapy. It tells you when to be cautious. So it'll give you things, it'll tell you things when to step up your therapy. And it'll tell you stop trying to treat yourself and go to a hospital. If you get so severe that medication is not helping, breathing is very difficult, you cannot walk or play, you cannot talk easily, and your peak flow meter shows that you have less than 50% at your personal best, you want to seek medical attention. So with all that being said, I just want to make sure I give credits to the sources that I used today. Now, one is the National Heart, Lung, and Blood Institute, the American College of Asthma, Allergy, and Immunology, the asthma page from the CDC website, WebMD, and the World Health Organization. If you go to any of these websites, then you can find a lot of information about asthma. I hope this was helpful for you, and thank you for listening.